Federal government approves additional 8.9 billion naira for June hazard allowance as doctor strike enters third day. Petroleum Products Pricing Regulatory Agency confirms fuel marketers free to sell at suitable prices. In international news, Oxford University halts COVID-19 vaccine trials after one participant falls ill. In the sport, League Management Company gives NPFL clubs 200 million naira condition for restart.
This is ANN News.
I am Olajumoke Olatunji. It is now 3 weeks since Nigeria recorded new COVID-19 cases above 300 as the Nigeria Center for Disease Control. New numbers on Wednesday were 176. This brings the total tally to 55,632. New infections were recorded in 17 states and the Federal Capital Territory, where 40 new cases were recorded. Lagos, the epicenter of the virus, confirms 34 infections, and Plateau State reports 26. The federal government has approved an additional 8.9 billion naira to pay up the large chunk of the June 2020 COVID-19 allowance to all health workers in the country. This with the hope it will satisfy the National Association of Resident Doctors, whose members are now in an indefinite strike. Correspondent Stage Badmus reports.
It's the second time in less than 3 months that the resident doctors, as they are called, will be embarking on an indefinite strike action despite the coronavirus pandemic. But unlike the first time when doctors at COVID-19 centers were exempt from the strike, the entire 16,000 population of the resident doctors are taking part in this latest industrial action, which is aimed at compelling the government to meet their demands for better welfare.
They have failed to procure a genuine life insurance, group life insurance for doctors and all health workers that have been fighting this pandemic. As we speak now, we have lost 14 of our members and none of them has been able to get any claim from any life insurance company. That is one of the demands too. Government has failed to pay us the COVID inducement allowance they agreed to pay us from April, May, June, July, August, September. And in that agreement, it was also stated that by September, they will review the hazard allowance, which is the supplementary sum of 5,000 naira to a better, reasonable amount. Then the state hospitals, tertiary health institutions have failed to implement the Residency Training Act of 2017, which is a law of the federal government of Nigeria.
But the country's Minister of Labour and Employment in a statement accused the doctors of being economical with the truth, insisting that more than half of their demands have already been met. He's now called a meeting with the leadership of the doctors to iron out the areas of differences.
If they can offer us something that will be tangible, we definitely want to go back to work. We want to go back to work, so we're not putting a timeline or anything on when we want to call off this strike. So I know that our members will not want to hear anything until they see tangible outcome.
While Nigeria's COVID-19 toll has been on the decline in the past few weeks, the strike action is likely to cripple an already overstressed healthcare sector, as more healthcare workers' unions are now threatening to join the industrial action.
You know, this issue of payments and strikes is becoming a problem in this country. You know, people should be paid their dues because they have families. They have to feed their families. They have their own things they want to do. But the oath they took while leaving the medical school also says they should, no matter how difficult it is, they should take care of lives. If they abandon those patients in the hospitals and they die, they've not been able to meet their moral obligations.
Attention is now focused on that meeting between the government and the doctors. If both sides fail to reach some kind of agreement, it could derail the country's fight against the COVID-19 pandemic.
The Debt Management Office has announced Nigeria's total public debt portfolio has increased by nearly 2.5 trillion naira. The figure now stands at 31 trillion naira. The office says 3 billion came from budget support loan, from the International Monetary Fund (IMF), while the balance consists of new domestic borrowings to finance the revised 2020 Appropriation Act. The data showed the new debt figure comprises of the debt stock of the federal government, the 36 state governments, and the Federal Capital Territory. Petroleum Products Price and Regulatory Agency says now that the sector is fully deregulated, so marketers are free to fix prices as they see fit. Barely 24 hours after depot owners called for full deregulation of the downstream sector of the petroleum industry, the Nigerian government has said it is already implementing the policy. PPPRA says since the introduction of the deregulation policy in March, it has ceased to play any role in determining fuel prices. The Kwara State focal person for the National Social Investment Program, Bashira Abdurazak Sanusi, says beneficiaries of trader money are reluctant to pay the loan. Trader money is one of the federal government's national social investment programs designed to reduce poverty in the country. Abdurazak Sanusi says 1 billion naira was disbursed to at least 10,000 persons under the program in Kwara State. She says Nigerians are not repaying because they think the loan is part of their national cake that doesn't need to be repaid. Abdurazak Sanusi says it is hard to track these beneficiaries because there are no records on them. The program was flagged off in 2019 by Vice President Yemi Osinbajo as an initiative to provide soft loans to boost small-scale businesses in the markets. Coming up, African stories. South Africa's economy slumps 51% in second quarter. And later, international news. Oxford University halts COVID-19 vaccine trials after one participant falls ill.
You are watching ANN.
Welcome back. This is ANN News. South Africa's gross domestic product plummeted by an unprecedented 51% in the second quarter of this year. This is the steepest contraction by any major economy during the coronavirus pandemic. Correspondent Sumitra Undu has the details.
South Africa's latest gross domestic product figures revealed just how severely the economy was impacted by COVID-19 during April and June this year. The president instituted a hard lockdown on the 27th of March, closing off all borders and economic activity.
This was a really big decline, the biggest decline ever recorded for South Africa. And certainly also, I think it's going to take us years to catch up on this. It's probably, we're looking at a period of 4 or 5 years to get back to levels we were in 2019.
9 out of the 10 sectors of the economy declined sharply. Agriculture was the only sector that showed growth. Manufacturing posted the biggest loss of 74.9%, followed by trade, catering and accommodation that was down 67.6%. No surprise as all movement and tourism ground to a halt.
South Africans at least were fed during the lockdown. So we've seen growth in the agricultural sector because that's the mainstay of food security. So that has shown very positive growth in the process. But also what we've seen is how the labor-intensive sectors have been negatively impacted on. Both mining and quarrying and manufacturing spectacularly dived because of the lockdown.
Economists expect a slight recovery in the third quarter, but that may be muted with increasing power shortages and deepening unemployment.
30% of all adults are officially unemployed, and the broader unemployment number is nearer 40%. We are losing jobs, we know that. it is really a concern, I think, that we have. We have to be very careful how we handle economic policy from now on, and we're going to have to be much more market aware and business aware than we've ever been in our lives before.
Women have been the most affected by the lockdown. Specifically, women have lost their jobs, impacting negatively on various households. Some of the households going to bed without food. So we need to really move speedily to opening up the economy, and in opening it, ensuring that we bring in more women back.
The government provided a $30 billion relief package during the lockdown, but it did very little to protect industry and business. Experts say it will take a few years before we see any real recovery in this economy.
Egypt has taken another step in its fight against the spread of the coronavirus pandemic. The government now gives one reusable face mask alongside distribution of monthly food rations. This will ensure that at least 64 million citizens who are currently beneficiaries of the food rationing program will use the face mask and help in slowing the spread. Correspondent Abdul El Marouki reports.
The Egyptian Ministry of Supply has started distributing cloth face masks with the monthly rations for subscribed citizens. Every family of 4 or more must get 2 masks monthly, the cost of which will be deducted from the ration card's balance. For families with 3 or less members, the masks are optional.
هو الوزارة كانت بتصرف بشكل اختياري بكمامات.
The ministry used to give an option of dispatching 2 face masks every month on ration cards. But in the light of recent measures taken by the government and the many violations by citizens to abide by personal preventive measures in public transportation and other places, it was forced to take this decision because daily infection rates are once again going up.
The cloth masks are durable for up to 30 washes. Each is sold at a subsidized price of 54 US cents. That saves $7 of the budget citizens need monthly to buy the disposable medical face masks. Yet for many rations benefactors, it's still a lot of money.
I have 4 kids, my wife and sister living with me. I need to get them 7 masks once or twice a day. That's up to $4. That's a lot of money. I have other priorities. Take rations. It means I can't afford other stuff. I need the stamps. Food will always come first, even before masks. The government should provide them for free.
لا أنا ما كنتش أتوقع يعني إن في كمامة بتنزل على البطاقة.
I didn't expect that face masks would be distributed on the ration cards. 50 cents is a lot of money. If I get one, what about the rest of my family? From where can I get money for the rest of us?
The Ministry of Supply is now requesting 28 million masks monthly from suppliers. That's up from 12 million in July. 400 clothes factories are now certified to produce these cloth face masks. With minimum wages set to $126 monthly, every dollar counts for many Egyptians. Most people cannot afford the budget needed for face masks. But now that the Ministry of Supply is providing a more affordable solution, the government is hoping that more people will abide to its COVID-19 preventive regulations.
Somaliland, a self-declared republic neighboring Somalia, has opened a representative office in Taiwan. The 2 breakaway regions, Somaliland and Taiwan, announced diplomatic relations 2 months ago, shrugging off furious protests from both China and Somalia. The self-declared African nation of Somaliland touted potential oil, gas and tourism resources for investment as it opened a de facto embassy in Taiwan on Wednesday, a relationship that has angered China and Somalia. Somaliland's chief representative in Taiwan, Mohammed Omar Mahmoud, said at the opening of the office in Taipei that there were an independent state establishment ties with Taiwan based on the common values of freedom and democracy. Taiwan has also opened its own office in Somaliland last month. Only 15 countries diplomatically recognized Taiwan over Beijing. In Africa, only Eswatini has diplomatic ties with country. Somaliland declared independence from Somalia in 1991 during the civil war. The country is not internationally recognized. When we return, international news. Oxford University halts COVID-19 vaccine trials after one participant falls ill. And later, sport. League management company gives NPFL clubs 200 million naira condition for restart.
You are watching ANN.
Whether in your house, at your office, on your phone or online, we are there. We have the facts behind the headlines. We cut to the chase with the news you really need. We cover every angle. We are the bigger, better news network. We are African News Network. ANN. Watch ANN News on MITV from a truly African spirit.
Welcome back. This is ANN News. The final clinical trials by UK's Oxford University for COVID-19 vaccine it had developed has been halted after one of the participants fell ill. AstraZeneca, which is partnering with Oxford University in the trials, said the incident is being investigated to find out if the participant's reaction to the vaccine was related to his reported side effect. A spokesperson for the company says it is standard review practice to pause a trial if there is, quote, a potentially unexplained illness reported in any trial subject, end quote. She said the participant's illness could have also been coincidental. Thousands of participants in Britain and the United States are being tested with the vaccine. Smaller study groups are also participating in South Africa. As of Tuesday, the cumulative number of confirmed COVID-19 cases in Latin America has reached nearly 8 million. Latest official data suggests infections in parts of Brazil and Chile appear to be moderating as several countries in the region studying the possibility of resuming international flights. New COVID-19 cases in Brazil doubled between Tuesday and Wednesday to nearly 36,000, with 1,075 deaths reported. Meanwhile, Chile's health ministry reports nearly 1,500 cases, COVID-19 cases in 24 hours from Tuesday to Wednesday, bringing the nationwide caseload to slightly more than 426,000 since the onset of the outbreak. Over in Argentina, a record daily increase of 12,000 COVID-19 cases was reported on Wednesday, taking the nationwide count to more than 500,000. Mayor of the capital city of Buenos Aires announced on Tuesday the government would expand COVID-19 testing to cover all close contact of confirmed patients, regardless of whether they have shown symptoms. Meanwhile, Colombia registered nearly 8,000 new COVID-19 cases between Tuesday and Wednesday, bringing the country's total to 700,000 cases. Colombia's immigration department says it is looking into international passenger entry quarantine and epidemic control policies as it prepares for international flight resumption in the next phase. Homeless persons and informal workers are increasingly going hungry in Brazil as the coronavirus outbreak shows no signs of slowing. In Rio de Janeiro, the state government has decided to take action. Respondent Lucretia Francio has the story.
It is lunchtime and the line is long. There are no signs of social distancing. Rio de Janeiro state government is trying to avert a hunger crisis among these homeless and unemployed Brazilians. Free meals at Rio de Janeiro's main train station. 6 months into the coronavirus pandemic, they have nowhere else to turn. Launched in August, the program is called Feed Rio de Janeiro and targets people in the state's most vulnerable areas. The Secretary of Social Development says the idea is to distribute breakfast, lunch and dinner until the end of the year to as many people as possible.
We are now distributing 6,000 meals per day. That is 180,000 meals per month. That will total over 1 million until the end of the year. That is how long we expect the pandemic to last.
These meals are a lifesaver for some, now that federal emergency aid has been cut in half to $55 per person each month.
This is the best thing that has happened for us during the pandemic, because we Brazilians are broke. I don't have any work.
It is very important for many people in need, and I am one of them. I'm trying to sell some stuff on the streets, but it's hard. So this free food is the real help.
According to the Public Defender's Office, there are about 15,000 people living in the streets of Rio de Janeiro alone. But that number has not been updated since 2017, and experts say it is likely much higher.
These people were already struggling before the pandemic hit, but now they're facing a triple burden: homelessness, hunger, and the risk of catching COVID-19.
The program is offering free food, but patrons are prohibited from eating the meals inside the delivery areas in order to avoid crowding. A recent survey conducted by UNICEF and the Brazilian polling institute Ibope revealed how grave the situation is. Cristina Albuquerque, head of UNICEF Health Brazil, says the numbers are alarming.
33 million Brazilians have run out of food and don't have money to buy food, and 9 million are really going hungry.
While the state government has budgeted for the program until the end of the year, officials say it can be extended, something that seems likely as Brazil reports about 4 million coronavirus cases.
Up next, sport. League Management's company gives NPFL clubs 200 million naira condition for restart. Please stay with us.
You are watching ANN.
We are on the road every day, canvassing throughout Africa for news you really need. We follow this story everywhere, from every corner of Nigeria to the wide African expanse. We bring you what's making headlines. We connect you with news you can use. ANN, African News Network, in a truly African spirit.
Welcome back. This is ANN News. In sport, League Management's company has released some conditions for clubs in the Nigeria Professional Football League ahead of the 2020-21 season. The LMC sets a minimum of 200 million naira for every club in the country's top flight league, a comprehensive insurance for its players, facilities insurance, and spectators insurance, and officials before the commencement of the league in October. 200 million naira is the guarantee commitment and confirmation for payment of salaries and other club operation expenses. All the clubs are also required to adhere to all COVID-19 safety protocols before they would be licensed. Serena Williams will clash with Victoria Azarenka in the semi-third Azarenka in the final of the US Open in 2012 and 2013. And I'm sure it will be a very interesting and exciting match. Good luck to both of them. That is ANN News this evening. Thank you for joining us. For details on these and other breaking stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I am Olajumoke Olatunji. Have a pleasant evening.